So hi Jack, thank you for speaking to UBTV today.
I'm a fourth year medical student, but I'm also president of Glencals, which is our medical student society. That kind of involves representing all the medical students, and there's a couple of different areas we work in. So we do a lot of academic representation, but also we'll do events, campaigns, and we oversee 60 sub-societies.
What has the impact of COVID been on medical students' curriculums?
Like everything, right back at the start of the pandemic, March lockdown, things like that, we were all cancelled, sent home from placement in the same way that the rest of the university shut down. The exception to that being the fifth years who had the even scarier predicament of being called up, stepped up into the NHS work, 6 months before they would have planned to do, had everything go on as normal. But for the students who did go home, that's quite a significant period that needs to be caught up. And with our degrees, it's not the sort of thing that you can miss some of it and forget about it. There are competencies and things that need to be signed off right at the end. Placement is different, but actually quite a lot of it's managed to adapt and get back to it. So again, thinking back to the last lockdown, lots and lots of services were stopped. And at the moment, we're at a real crunch point and things are starting to get like that. Surgeries being cancelled, procedures, clinics not happening. But up until this point in the year, actually quite a lot of them went ahead.
So overall, even though some students have been able to complete their placements, less students are on placements than previously. And overall, do you think this is going to be detrimental to their degrees? Do you think that there's going to be, you mentioned catch up, do you think that some students will graduate later, or like they did in March, they'll just be fast tracked if needed?
I think probably not, and certainly not on like a widespread number. There is time to get there. There's a sort of leeway period, which we do call an elective, which is where you choose an area of study and usually would travel to anywhere in the world to undertake that. In terms of early deployment is also a really interesting conversation, and that's kind of happening nationally. So all the impression we've got from Bristol Medical School, which is very similar to the vast majority of medical schools in the UK, is that this year the students aren't ready for early deployment.
That's very interesting to hear. And what's the larger medical schools policy on students working in COVID wards? Because they're not sending any student out to go and work on a COVID ward. It happens in quite specific circumstances. So which students end up coming into contact with COVID cases in their daily placements?
In terms of the medical school policy on placements and learning, there isn't a blanket ban on seeing COVID patients.
Okay.
I think it's been something that's actually been quite misunderstood by medical students and might have felt restricted going into certain spaces. The way that works from the medical school's point of view is that they defer that to the trust. Each of them will have their own policy on where exactly the students that they're teaching can go. So some of them might restrict them from going to COVID wards. Students will also have an individual risk assessment.
And it's obviously been reported that NHS and frontline workers are suffering in huge numbers from mental health issues. Do you know how students who are finding themselves on the front line, both coming into contact with COVID and not coping, is the university or perhaps the government offering them adequate support?
Yeah, I think this is probably, like for all students, really the most challenging year for mental health. And I think we've definitely seen examples of worsened mental health among our students. That's a combination of lots and lots of factors. So it's the kind of concern and the worry about yourself, your family becoming sick. It's being part of that team that is working on the front line, being around people who are working really hard, who are burnt out, seeing patients with COVID or patients who are seriously unwell. On top of it, there are other factors. So one of the real difficulties, as I said, we have kind of 7 academies across the Southwest region. So students could be as much as kind of 45 miles away from Bristol. In terms of support, I think, and you mentioned, is the university, is the government doing enough? On a whole systemic level, we're not approaching mental health in the right way, and there is the taboo around it. There is no willingness to speak up, which is amplified in medical students because there's a fear of things like fitness to practice and it going on your record. So I think on that whole system, there's not enough being done, and that would be the case whether there was COVID or whether there wasn't. There have been really good examples of when students have been isolating because of becoming a contact or a positive test, particularly when they're on those outplacements. And the support by the academies there has been excellent. So I know there have been examples of them kind of bringing food parcels to the students that are isolating, taking laundry away, doing it for them.
I just wanted to go back to one thing. You were talking to me about students being worried about reporting struggles with mental health because they're worried about being labelled unfit to practice. Do you think that the pandemic has perhaps highlighted issues with this mode of functioning?
I don't think the pandemic really has highlighted any more than it already was there. Actually, the risk of that's really quite low. And the other really important thing is that having a mental health condition isn't a barrier to being a doctor. What they want to see is that you have an awareness of your condition, you're seeking treatment, seeking help where you need it, and it's making sure that you're not compromising the safety of your patients.
Do you know if there's been a larger number of dropouts amongst medical students in comparison to previous years? Do you think that the pandemic has fueled that in any way?
It's not something I've become aware of in my kind of sense. There will have been a small number of students who've had to defer a year, and that was for students who were high risk.
Have medical students reported any sense of frustration towards the larger student community? Because I know the student community is often singled out as not respecting government guidance in terms of coronavirus measures. Do you think that this is a source of frustration for other medical students?
Yeah, I think so. And you know, it was around the time that Eat Out to Help Out was happening, being encouraged to go out, and then, as you would expect, as the science said, the cases go up, and then students got the blame, students and young people. So I think there probably is a degree of frustration, especially among a group of students who are going to placement, who are working in these hospitals, while they might not, I mean, some of them are working HCAs and being an actual part of the team that needs to provide care. While we're not part of the team providing direct care, it's that learning process that we need to go through to keep an NHS staff. There's an extra motivation to it. So as well as the sense of protecting yourself, protecting your family, protecting your community, we have to protect our patients.
Just before we finish, I wanted to ask a more general question. Do you have a message of hope that you would perhaps like to share with other Bristol medical students, or perhaps something coming from the board and the people you work with?
I think my message of hope is that the vaccines are coming. One of the absolute privileges of being a medical student is that we are classed as key workers. We're in priority group 2, and probably by mid-February, most of us will have been offered a vaccine. I think that opens up the opportunity to do so much more. We can bring our community back together. We can physically meet and things like that. And I think these are the stepping stones. They're getting us there. So it will pass. People have been absolutely amazing at supporting each other, working through the difficulties.
Great. Thank you so much for speaking to UBTV, Jack. Thank you.
Thanks so much for having me.